LIANA, the world's first sitting, standing stabilizer. With LIANA, the goals of early mobilization such as cardiovascular training, pneumonia prophylaxis, delirium prophylaxis, and muscle strengthening can be achieved more simply and effectively. LIANA enables the patient to experience a different visual environment at the edge of the bed, where they are able to effectively practice standing up for the first time in front of the bed. LIANA is the optimal aid for nursing staff, easing their strenuous day-to-day work mobilizing immobile people. In the majority of cases, the conventional approach to the early mobilization of intensive care patients suffers from the following drawbacks. The scarcity of space in the patient's room makes it difficult to work with the conventional mobilization chair. A patient transfer board is required to move the patient from the bed to the mobilization chair. Most patients find this painful. During the transfer to the mobilization chair, none of the patient's own resources are employed, because the person concerned is frequently passive throughout this step. Access ways, such as for ventilation, central venous catheters, arterial and intravenous cannulas, have to be extended, or they can be accidentally disconnected during the transfer of the patient when performing conventional early mobilization. This costs time, and in the worst case, it can be painful for the patient. In the case of immobile or incontinent patients with skin defects in the buttock area, the time they are able to sit is reduced because the conventional mobilization chair has a harder surface than the bed, so that pain is experienced within a shorter time in this situation. In addition, there are higher staff-related costs, especially in the case of adipose patients. The workload increases significantly here. As a caregiver, I experience these issues almost every day, but now that's a thing of the past. LIANA offers you a genuine alternative. My name is Boris Badertinov, and having experienced this challenge on a daily basis, I was motivated to invent a manual sitting-standing stabilizer. Years of collaboration between nursing personnel and motion care has seen LIANA continuously developed to become a professional medical product, designed for the needs of nursing staff, patients, and hospital management. Come with me, I'll show you the benefits offered by LIANA. LIANA is a mobile, flexible, technical and versatile medical device that nursing staff can use even in the constricted space available at the patient's bedside. LIANA allows patients to be mobilized at the bedside for the first time with just one or a maximum of 2 nursing staff. Firstly, this results in significant time saving and the physical strain on nursing staff is minimized, while secondly, the patient's own physical resources are stimulated and developed. The patient can rest in the soft bed and is spared from having to lie on a hard board. It is not necessary to extend the cables or infusion tubes. After being placed down, the patient only needs to be gently stabilized by a nurse. The bed is then lowered until the feet can be placed firmly on the ground. The individual setting options of LIANA allow the back, headrest and armrests to be flexibly adjusted to the constitution of any patient. Stabilization belts are placed around the patient to give them a secure seating position. If the patient wants to stand up, LIANA can also support them in a vertical position. Because the patient is either in bed or directly in front of it during the early mobilization phase, it is possible to return them to the bed more quickly and comfortably. LIANA was developed by professional nursing staff and motion care for patients and nursing personnel with the aim of significantly boosting the efficiency of the working processes. It also protects nursing staff from physical overexertion, so helping to keep them healthy. By making work easier and improving working conditions, it increases employee satisfaction over the long term. LIANA, the world's first sitting and standing stabilizer.